My presentation in the 2021 ASCO annual meeting is on adult Philadelphia-like acute lymphoblastic leukemia. And it will be available on the annual meeting website on June 4th. Philadelphia-like ALL is a relatively newly discovered entity. It's been almost 12 years since it was first described. And this entity shares similar gene expression profiles with the other kinase-driven, well-known Philadelphia-positive ALL, but it lacks the characteristic BCR-ABL translocation. The identification of Philadelphia-like ALL in clinical practice is very challenging, and most testing platforms required for this identification are not really widely available. At Mayo Clinic, we developed a fish-based diagnostic algorithm that allows timely and reliable recognition of this entity. And we applied this diagnostic algorithm to stored leukemia specimens from the Mayo Clinic ALL cohort. And this is a highly annotated cohort of 350 B-ALL patients diagnosed and or received allogeneic transplantation at the 3-site Mayo Clinic Cancer Center over a 12-year period between 2008 and 2019. After we identified Philadelphia-like ALL cases, we compared their outcomes to other cytogenetic groups in the cohort. This project was funded by a 2020 ASCO Young Investigator Award that was supported by the Florida Society of Clinical Oncology and is being presented at the annual meeting for the first time this year. After applying the diagnostic algorithm, we identified 33 patients with Philadelphia-like ALL, and they comprised 9% of our cohort. Patients with Philadelphia-like ALL were younger, had a higher white blood cell at presentation, were more likely to be of Hispanic ethnicity, were more likely to be treated with pediatric regimens, and this is a reflection of the younger age at presentation, and they were less likely to proceed to allogeneic transplantation, and this is a reflection of increased utilization of pediatric regimens in this group. As for outcomes, patients with Philadelphia-like ALL had worse results on every outcome that was measured. They were less likely to achieve complete remission, more likely to be MRD positive after induction, more likely to relapse, and had lower overall survival than other cytogenetic groups. Philadelphia-like ALL is a very genetically diverse disease, but fortunately, these genetic alterations diverge on a few druggable pathways. Therefore, early and easy identification opens the doors for clinicians to integrate targeted therapies in the frontline management of these patients and subsequently risk adjust their management plan accordingly. Currently, there are several clinical trials investigating the role of such targeted therapies in the management of patients with Philadelphia-like ALL, and we are all eagerly waiting for the result.